Are going to continue discussion around budget, and we're going to put up a spreadsheet that we like to work off of in-house healthcare that has sort of all the budget lines and requests we've received, and we start going through them. So we're just going to go through them, make sure we've got everything on there that we need to have on there. And we'll put that up in a second.
You make sure I get a copy too, hard copy.
I'm trying to figure out if I'm doing my Zoom correctly here. Try just to share.
Next week.
Yeah, because I want to share one. And then I didn't join any of the audio stuff. Yeah. Where we should be?
Yeah, I think so. Oh, wow.
Where is this on here?
It's not on there yet. It's in here.
It's coming.
It's coming.
So first, just an overview of what you're going to be looking at when your hard copy comes in and when this gets, I guess we'll have to post it. This is a draft, but it should include at the top, the blue rows are kind of your navigation points. The top one is the governor's recommended one-time funding. So we've gone through and pulled out the one-times that we could typically weigh in on or probably want to weigh in on. So any major changes or recommendations that the governor is making to things in our portfolio that we may want to give attention to. And you'll notice the blank columns toward the right. That's our position and our priority. So Alyssa can tell us process-wise whether we're going to prioritize this right now or if this is just kind of a walkthrough. The far right column is the detail of the programs. It can kind of help us refresh ourselves with what we heard in testimony or what was on the write-up around the programs. Yeah. The next blue line down is the governor's recommended, and this is base, not one time. So this is stuff that is either being added to the base funding or is, I think there's 1 or 2 cuts in there that the governor's recommending. There were the Howard Center ones that Sandy from Howard came in and testified on. So those are a topic of conversation for us. And then the next blue line down is where we have grouped like the blueprint stuff that we just heard about. It wasn't in the governor's budget, but it's definitely something that we want to pick up and kind of see what our position is on putting that in our recommended budget that we send to approach. Similarly, all of the other organizations outside of the state agencies who have made recommendations or asks of us, those are all reflected in here. The yellow boxes that you see are places that I've just simply got to add the numbers. And if anybody sees one that they have at the top of their mind, just call it up and I can fill it in while we're working. So the next couple of lines down at the bottom are specific to reimbursement rate recommendations. And there are a lot of yellow boxes. So some of these folks have just recommended non-specific numbers, but adjustments, but I didn't grab the specific number yet. So I can follow up with you or send me an email if you've calculated the rate and I didn't get it. Finally, there's a space for other recommendations. So if we're taking up a bill that has money in it, that's where it would go. And if there was a language recommendation, Green Mountain Care Board asked us to take those 2 positions or 2 positions out of the pool and make them classified positions so they don't have to request it from the pool every time. So that's an example of something that I put in the language needed. So specific policy asks. So that's the organization of the document. And I think I probably should have started with the top columns. You'll see the funding columns have column E is the gross amount. And then F is the general fund amount. So that's it. General fund is, the difference between those two is Medicaid dollars,
Federal dollars.
federal dollars, usually Medicaid.
Yeah.
Are there any questions about the organization of the document?
Just for me, people on the left, you have that E column, you just may want to explain the E section or those B,
Column A.
Yeah.
Column A is referencing the sections of the budget. And that's just really to help appropriations navigate to the section where this is buried in the budget.
And buried is the right word. It's helpful to look at that.
First of all, thank you.
Yeah, it's incredible.
An enormous amount of work, so thank you. Do we want to start kind of going through and refreshing our memories on these? And if we've forgotten anything,
Oh my God, sorry.
Daisy, since you've been enmeshed in building it, do you want to sort of lead on it?
Yes, I can definitely try it. I'm trying to get rid of this. Okay. I'll definitely need help with my own memory of these, okay? But let's start.
Wait, just before, where do you find this?
The same one.
Did we get it? So how we going on that?
We've done that in the past,
Yeah.
from the various.
You can send it to Tony. I mean, could you?
Oh,
So like 306 is what we're.
Oh, perfect.
okay.
Is it posted, Kristen?
It's a different.
It's under Nolan.
But it's a different.
It's a
It
different.
shouldn't be under me.
Yeah, it's a
should be-
different version.
Well, it's not my document, so
I mean, what you have here is not.
it should be under Representative Rebecca. I'm just sitting here for whatever reason.
Window dress.
I'm window dressing,
Looking good with that dress.
grab my new glasses.
What's on the note in this?
Can you shrink it?
It's
Can you
not.
shrink it?
Okay, let's give Kristen a minute to fix things.
Okay.
All right. How's that? A little bit better?
It is. Let's start with the first one since that's what we just dealt with. And we can start that while Kristen is posting it so that we can all bring it up on our own personal devices. And in the meantime, let's start at the top.
Okay. At the top, this is not a good one to start with because I left it blank. Green Mountain Care Board. This was actually in the governor's recommend, in the base. So 10 million. And if you go back to Green Mountain Care Board's, their budget testimony and ask, this was in it. Woody's got his spreadsheet out. Yeah, this was in their ask. And it was for, remember, the governor funded 3 positions. And then the ask of us is down later in the spreadsheet. They wanted an additional 2, and so you'll see a separate line later for that. But this was already what the governor put in their budget, and it's a $3.9 million general fund request.
And Dave, that was that's including how many?
It's three of the positions that they need.
Okay,
To
that's
start
in the
up,
3,
yeah.
that's it. The other 2 is not on that.
That's right.
So really, if I might just type in Nolan Mangler, Joint Fiscal Office, what you're seeing in the sheet is the full ask.
Yeah.
Full base of the Green Mountain Care Board and not the specific. And so maybe the sheet should not show their base, but just the cost of the 3 positions. Because we're not doing basic asks for everybody.
That is what I was wondering, because
That was
I was thinking 3.9 million general fund is a lot for three positions.
750,000.
No, but here's the thing, but
They haven't separated out though.
we can find that out, but I think, but this isn't this what Representative Rebecca's issue, I mean, we've got to put this all together, so this is like, you're seeing the rough. Like, you know, she's been working on it, so we're gonna find these little things, but
So I have in my spreadsheet from that day, the total ask for those three positions was 750,000.
Perfect, thank you, Marty.
that sounds about right, I mean, I have their. So,
Is that all general fund?
Diane, would you like to?
I would love to, Madam Chair.
Yeah.
And others, Diane Lanford, Agreement with Care Board, you are correct, that was our, base budget and it included the 750,000 that the governors recommend included in there, it's not an additional ask, it's what's there now. And we would like you to support it for the three positions, and later we'll talk together.
So it's 750 gross,
Hmm,
but do we know how much of that would be general fund?
I don't think that's,
40, 60,
I don't think that's for the three positions, I think that's for a lot of things. Three
maybe
positions,
the three positions and the contracting.
yes. Contract, that's the, oh, I'll tell you what, we will get you an updated number, right?
Yeah, I think it was in your email,
Yeah, I just have to look in my email. I have time. All right.
but that was what the governor, had in his recommended is the 750.
Yeah, she didn't send me a bunch of stuff. I just hadn't had a chance to look at it. Oh, wait, here it is.
Why don't we type in that Green Mountain Care Board? The proposal description, just 3 additional, like you're already doing. Thank you. I'm watching you update it as you're doing it.
Here it is. One.
Right. Next one?
Yeah.
Alyssa, can you?
It's on that.
So this is what's in the base already. That's the expansion that we did last year. Raising Quimby to 145, our V farm. So that's base funding. That's already in there. And that's based on action we did. And do we have another line a little bit later on in House Healthcare's proposals about expanding Quimby to 150? And I am not sure.
Control F for QMD.
No. I'm wondering if I received anything from Diva.
We do. I'm pretty sure. I don't want to lose my spot on the screen, but I'm pretty sure we have something down below.
I think so. So hold on 1 second, everyone. Can I make a request of the people sitting around the room? If you're listening to us fumbling around for something and you happen to know, feel free to pipe up.
This is working.
I can imagine it must be really frustrating if you're sitting around the room like. So does our healthcare advocate? Oh, I found it. I just found it, but you can, do you want to summarize it?
No, I think Stephanie sent you an email.
Yes, I believe I received an email from Alex, actually. To raise it from 145 to 50. It would be general fund 416,766. Gross would be 0.41651 million.
Where are you?
I'm on a memo that was sent to our committee from Stephanie Barrett at DEVA on what additional would be required. So these are those numbers.
And so do you want that?
That would be under healthcare MSP recommendations, if we recommend that. So that would be 416 general funds. Can I make a proposal that we accept this this base funding for a program that we expanded last year? Can I say that House Healthcare supports this? I'm talking about what's in the governor's budget.
Yeah, I'm just, wait, to clarify, it's what we already passed.
Yeah, just for expediency. Leslie?
So I'm sorry, but I'm feeling confused about what we're talking about. There's the top four, which are up there. I'm not sure why those ones are there, like what makes them earn that.
They are in the governor's recommend,
But there's a lot of other stuff in the government.
and they are in his base funding.
Well, and so I guess I'm not sure I understand the difference between base funding and recommend. I'm being really dumb.
Base funding is, they're in there every year. They're in the base budget.
Okay.
And these are new in the base
So
budget.
this is new money. So that's the idea that this is the governor's new money?
And they're in our portfolio. And they're ones that we might want to weigh in on.
No, I get that part. I just want to understand what the governor's saying. So what the governor is saying, he's asking for new money from us.
Based on things that have passed, based on new programs, expansions, like say, then it now needs to go into the base budget, and these items are new base budget items.
But we passed the
We
policy
passed
last
policy,
session.
yes.
Yes, so I want to make a suggestion that we don't even talk about these.
I agree.
Okay,
I agree.
So that was where I was stuck.
Yeah, that's, can we all agree that we're gonna support all of these?
yes.
Okay.
So just a question, it was 145, but we recommend 150.
That's lower down, right?
No, that's a new policy proposal.
New policy,
It's
where you
like
listed,
45%.
Melissa just read, and I'm just
Yeah.
typing it
It's
in.
in the ads,
It's in the ads.
yeah, for 7114.
Okay.
Yeah.
Can I just,
Okay,
okay,
Alyssa.
sorry, this recommended base funding, that's what the governor has in his budget.
Yeah.
Okay. So that's already in there, that's what we passed on.
Right here.
Tell me the numbers for,
General fund, 416,766. Gross, 2416051.
wait, is that first one right? No.
416,766.
You were up.
Okay,
It's 145%.
well, yeah,
The government meant.
416.
It's the Medicaid,
On your seven.
Global commitment funding.
But if I may, we did get a request from the Howard Center to reinstate. So are we then saying we're not?
We're gonna get to that.
Okay.
Okay,
But what is the general phone number? Because it shouldn't be more than.
Yeah, that's what I said it's not. She said to put in another 7, and then you said I have too many numbers.
oh, your numbers just need to be changed around though.
Okay, Alyssa, do you wanna,
That's why I never do math in public.
oh my God.
I set you up for failure, didn't I?
And I take out the 7 now.
The gross number is 4169.
Just take out 7.
Okay, one thing at a time.
4
ones, tell me the gross number.
2416051.
And general.
And general is 416766.
Okay, that was
Okay.
painful. Now let's
Yes,
go
that was
to
painful.
governor's recommended base. Lori, are you saying let's not talk about
Let's
these?
not talk about it. I agree.
It's a base and not a policy, so.
Diane,
Right,
But we are gonna come back to powers and one in another item.
yes. It's not on here again.
Oh,
I don't think it is.
well, actually, no, we actually really do need to talk about.
We do.
These last two items.
Okay.
These were the two items that DMH proposed to cut from the base. So one of them was the embedded clinicians in pediatric offices. I believe they said that they were in two pediatric offices, one in the Northeast Kingdom, one at Milton Family Medicine, Milton Family Practice. And those are positions that are funded through the designated agencies funded by DMH to those two designated agencies, which are then vetted into pediatric offices. And they have recommended ending that funding. Does anyone,
It has the numbers that they requested, if that's helpful.
yeah,
Yeah.
are they different than the numbers that are up there?
That the Howard Center requested.
Oh, let's
keep
get,
that for the next
let's
section.
keep that for when we get to when,
Okay.
right? So we,
It was for the thing. he's mentioned.
Lori, do you?
Yeah, after down below. So I have something about the community outreach program.
Wait, can we stick to the?
Yeah, can we, let's talk about the first one. Before we move on to, so we're not talking about whether, I just want to get everyone's general sense of whether or not this is something that you would like to fight for. What everyone's feelings on it are.
Do
Lori?
you know why they are cutting? Why is there like something else going in this place or?
Well, they're a pilot that have been going on for 24 years. Yes. Based upon what they were telling us, that the one in the Northeast Kingdom, that there's nobody actually, Woody, do you know?
Hasn't been filled.
Hasn't been filled in 4 years.
right,
Oh,
I remember that.
I will say that apparently this pilot was initially approved to be in pediatrics, and that was what it was supposed to be used for. And do you remember that they showed us the numbers of people served? And it was 11 children, I think, per month. And we thought, wow, one social worker for 11 children helping. And it turns out that that social worker helps lots and lots of people. And it happens to be in a family practice, so they're helping adults, which was not what it's intended, not what it was meant to be.
It was funded for 11, but they were doing a lot more.
They were funded for pediatrics and they were doing adults.
Right, but the funding was for the pediatric 11.
No, it was for this particular person to only do pediatrics.
I think we're saying the same thing.
No, it wasn't funded for a specific number. It was funded for a certain
For the
population.
pediatrics, and they were seeing 11 pediatrics,
Yes.
but they were doing a lot more.
Yes.
I think we are saying the same.
Yes. And we also I just want to remind everyone, we just heard the blueprint around community health teams. And the blueprint does provide community health teams, which is available to all blueprint primary care practices. And they do have embedded social workers that support that. My recommendation is that we approve this. No, okay, I'm okay with
You're
it.
saying leave it in.
Approve that it,
Rejection.
Oh,
that is,
okay.
that it can be removed.
Reprove the governor's recommend.
Yes,
Okay,
approve the governor's recommend to remove.
You're talking about the 160.
No, the one above it. That one. Daisy, you want to talk about the next one? You want to talk about the next one?
Sure.
Let's step up this one.
I was waiting to see if anybody else had anything to say about the other one.
The Green Mountain Care Board one, since
The Green Mountain Care Board does.
I'm not sure, but thank you, Diane, the Green Mountain Fair Board. I just wanted to be clear on something here. There are 3 positions. And they're not for a head. That's gonna come later. We're gonna ask for those later. Okay, but there's 3 positions. Gross salary $750, general fund is $300.
Thank you.
$450 is out of bill back. I just want to make sure that we're not representing it wrong. Because later on, under when you've got additional ask, we're gonna ask, the Mountain Care Board has sent a letter that we're going to request that you help support us with a new additional, if a head goes forward, the 2, with those 3, make the 5.
The two that they want
Okay, I'm
to
gonna stay on the one that we're on and then I'll come back to you, Diane, because I know we have it very clear in your presentation, so I'll just go back to that.
It's in 2. 2 is later.
Right now, we're supporting the governor's 3.
Right.
Then we'll.
The governor's 3.
All right, Daisy, community outreach.
Thank you for.
Did you want to let anybody else say anything about the one that you don't want to fund?
Did anybody else want to say anything? I'm sorry, yes.
Hi, Amy Jonathan, Vermont Care Partners. I just want to remind the committee that for those positions, there's 2 embedded in primary care, but that also includes crisis positions through First Call for Howard Center. So that would be a cut to those positions as well. So that 500,000 is not just to embedded social workers and pediatrics, it's also some first call staff for Howard as well.
Oh, that clarifies the amount. I was really curious. I was like, that's a lot of money. That's what I was thinking. I wonder how much their bonuses are, is what I was thinking. Community outreach program. I feel like we've already said a lot about this in here, so everyone knows my feelings about this program is the strength of it and the strength of it that I've learned through talking to my municipal leaders, but I also confirmed with my municipal leaders that they have written into our budget the gap amount for funding this, given the cut that we noted in the governor's budget. So it's going to be funded through our local municipalities. Lori.
I think we need to be clear that those budgets have not passed, and that's my concern. So, and I apologize, I haven't been in the committee when we had this discussion, but this community outreach program was started by this committee several sessions ago, and is a outreach program that doesn't bill. So where we have the mobile crisis statewide, they bill to get enhanced Medicaid. So this helps a group of people where they might be in crisis or there might be a situation, and instead of, stopping to be like, we have to bill, they're being helped. And so it is getting to a different population than the mobile crisis is at this point. And I think what I would like to see is my proposal on the table is that we continue to fund this and put in language that we will only fund it for this year in order to give the municipalities time to really show that they can fund it on their own and or ensure that the enhanced mobile crisis is fully up and running in Chittenden County. I'm just going to give you an example. We, as a business owner, have called the community outreach in Chittenden, in Essex, when we've had people who have needed mental health help that have stumbled into our shop, and for some homeless who have been camping in our on our yard, which is fine. We were just called for, we wanted to make sure they had services. And so I just feel like this is a level of help that is not necessarily yet available with the enhanced mobile crisis.
All right.
I am concerned about the municipalities and we did not specifically hear from them, did we? So I would support something like this that would give us more time to hear from municipalities. I don't like at a state level doing things that adds burdens to our municipalities, especially if we haven't heard from them.
And knowing that budgets haven't passed yet. So like, I know in our community, I talked to our chief of police, it is an additional $30,000 budget hasn't, right? So the budget could be voted down in all these municipalities. And then it's up to the select boards or councils to figure out where to cut the money. And then my also understanding when I talked to our chief of police was that it's not even covering the full amount potentially. So that's the concern I have as well.
In my notes, I have 655,000. Is that correct
No,
for community outreach?
that's the total for the program, but this is the portion that's getting cut, I believe.
It is a state municipal share now, I believe. And so this is this.
This is a grant? Is this a grant money?
It's been in base funding since it was started by this committee when you might have been on it. But yeah, it's base funding.
Although Woody, I would check that. I don't think this it's 6 something. I think it's closer to 3. Amy, I don't know if you can confirm that, but I feel like community outreach, the total budget of it is 3 something, not 6. You might be thinking of street outreach. Yeah, I'm with Lori. I think, I expressed that to the commissioner as well, that I think they have a really good point and also goal and vision with regard to crisis outreach and supports for our local communities, and that the integration with, crisis response and urgent care and mobile crisis response and 988. I mean, that's the vision we want for crisis care in Vermont. It's brilliant. It is the best use of our limited resources and human resources. But I think we're not there yet from what I hear from talking to a lot of people. And I think we need to continue this until, like you said, we can prove that our communities are ready to pick up the local costs.
Anyone else have that? Tupper?
Daisy,
Yeah, Tupper.
I just want to make sure I understand what happened. I thought you had previously said that the municipality was going to fund it. Is there a reason why do you think that it can't be done now?
I don't know if my municipality has it in their budget.
Yeah.
So they're taking that risk. There are 8 other communities. I don't know if it's in their budgets.
And I would say in our community, we haven't voted on our budget yet. So that's the issue.
Yeah, even if municipalities did put it into their budget, the budgets haven't been voted on yet, whether or not they'll be approved.
So if they're in the budget, let me just ask this question. If they're in the budget and it gets passed, what do we do then? What's going to happen then?
I can tell you what I'm gonna do in my community. It's talk with my municipal leaders and ask them, how is it going? How is what are our outcomes locally, and talk with Howard Center, what is it locally? And just see what the impact is. see what our impact is, if there's needs for that money in any other place in our local budget. But I know one thing, like, I don't want to ask anybody to pay any more money this session. I really don't, but I also don't want to ask people to put up with, going without care when all they need is someone to sit there with them for 5 minutes who's willing to do it, and it's a job for somebody and they love doing it, and I could go on and on about this.
I get all that. I'm just thinking in my mind, if the budget passes, they've got the money to do it. So what happens to this? What happens to it?
In the
The
BAA,
160.
right? In the BAA, we would change it and give it to something else. And I can tell you, there is no shortage of places that DMH could spend that money, right? We know that.
I think this is incredibly important work. I worry about DMH's proposal to wrap this into 988 and enhanced mobile crisis. To me, those are sacred things and should be sacred on crisis. And not watered down with community outreach. I worry about not taking our most acute options and trying to wrap everything into it all. So I'm worried about that. I know from my community, same police department that Lori has. I know that every single year when we meet with our chief of police, all he talks about is the work that they do and that their department could not do the work that they do.
That community outreach.
That the community outreach does. I think it's essential. I wish it was in every single community in the state. And so I would not support this cut for a year while communities are given the time to find other funding. And while DMH perhaps works on better ways to fund a true community outreach rather than just lumping everything into crisis.
Right, and I'm okay with them lumping it into crisis. I just want to make sure that the level of care that a community touch team is doing is also then being done in crisis if they want to do everything you want bucket, bless you. But we focus on crisis, and sometimes I feel like we leave the lower level behind, and that would be my concern with this. I will also say the chief, when I talked to him today, said that they are extremely thankful for the mental health urgent care that is set up in Burlington, because they are able now to take some people places other than the ED. And so I do think it's starting to work, but it just needs.
I agree. So I also would be.
Okay, no, go ahead. It's not a big number, but I just want to have this committee recognize that we've got a long ways to go. And we've got to put out a responsible, affordable budget here. And I think that's important, but we're debating over $160,000. We've got a lot of other stuff here that's going to be impacted. And I think we better, like I said, I'm not saying yes or no on this, but I might say yes or no when we go through the rest of it and I see the top figure. So I guess that's my 2 cents.
Why don't you say yes or no?
Well, I will.
Help us move along.
Can I say something? No one sees me.
Yeah, I was gonna say, Brian,
Nobody sees me.
Brian, you're on there. I was about to call on you.
Okay.
I'm sorry, I can't see hands.
Yeah, I figured that's why I spoke up, and I don't want to be rude, but then I was like, this might be my chance. And I'm having a hard time talking. So I'm gonna try to keep it short. I think we should take more testimony later about the nature of this work and how it connects with crisis so that everyone has a more equal understanding of the continuum of services that are provided between outreach and crisis, ranging from like very low level prevention to all hands on deck jumping into a crisis situation. Because the mobile crisis team and the community outreach team work closely together in many situations. And so like I just think taking the time later to get into that more instead of me trying to talk about it more now would be good. Because I think there may be room to think about how we have a more interconnected continuum of care from the highest level of a response to the lowest, if that makes sense. Like from the most severe situations to prevention. Like I think we could do better in the system, but right now I think cutting a piece and cutting this piece out would be very harmful. So I would not suggest cutting it out, but what I would suggest is we look at ways to improve the system of care and better integrate things if there's concerns about the response from DMH. So I'll just leave it at that.
Which is why I think I'm recommending, and others recommended, that we keep it for 1 year. So that we have time to understand the intricacies between the two different. And take testimony on that, which unfortunately we don't have time for.
Oh, there was one other thing I wanted to throw in there, which is that although it might save a little money to cut something like a program like this out, the expense on the system later would probably be higher because the outreach workers are preventing law enforcement involvement or diverting people from that. So yeah, thanks.
Yeah, I agree. What do you have to say?
Just looking at the Howard Center letter that they sent to us. Yes, $160,000 grant. They also talked about the elimination of $495,000 for administrative Medicaid funding. And I don't know whether you've included any of these things or whether they're on the list later on. Are they?
Yes, I was about to point that out, that the embedded clinicians in pediatric offices, actually, that line isn't clear enough to say that it includes the first call positions as well.
Okay. And then there was the Milton Family Practice Collaborative. Is that?
Yeah, Alyssa mentioned that. It's in that
Okay.
line above.
That's 78,000.
That's in the line above.
I can't see it, so I'm just
Line
going.
9. They're all in line 9. They're all.
Okay, it's all together, okay. And you have the Chittenden County first call, 416,000. Okay, we can verify this, I guess, right?
Yeah.
160,000 for the community outreach. And I think that's it for their items on the letter that they sent to us.
Back to community outreach, is there anyone is there anyone who does not agree with keeping it in there for 1 year with language in the budget? Continuing.
Saying it's only for 1 year.
Yeah,
Do we have time to work on the language between now and the weekend to make sure we're all in agreement on the exact language?
there is no weekends. Our budget is due tomorrow afternoon.
Oh, so we need to have it by tonight.
Our recommendations need to be in by tomorrow afternoon.
Yeah, I'd be happy to work on the language with someone just to make sure it's just so I don't take up more time now talking about it.
I think we'll let council work on language with you, Lori.
Can I send my thoughts to Ledge Council then?
Absolutely. All right, can we move on from, did we? Let's move on to one-time or healthcare recommendations. So these are recommendations that we did not receive in the budget. They are not in the budget. And they are from various organizations we heard from. And let's just start going through them. So the first one is Medicare Savings Program. And that is raising Quimby from 145 to 150. It would expand Quimby to 2,272 additional Vermonters. Remember, that is people on Medicare because they're either over the age of 65 or they're disabled. Quimby covers not only your premium for Medicare, which maybe our healthcare advocate could tell us what 2025's monthly premium is.
So Mike Fisher, healthcare advocate, someone will text that to me in a minute, I'm sure, but not only the premiums, but also the cost share.
Yeah, so the 20, after Medicare, you have 20% cost, co-insurance. And you have a yearly deductible, which is somewhere around
She's
$800.
on
So
307.
Quimby covers that. Essentially, Quimby makes it so that folks in this age or income level have no cost share for their insurance. It also aligns those who qualify for low income subsidy for prescription drugs lists. It aligns those on list with those on Quimby. So there's an administrative savings possibly from not having to align the between 145 and 150. Any thoughts on this?
For it.
For it?
It seems like a no-brainer. I wish we'd caught it last year.
Hey, yes, bring that back when we prioritize it. Are we prioritizing
Yeah,
it later?
is there anyone who opposes this?
It's very difficult for me personally. When you ask that question, do you oppose it when you're going down one by one?
Okay,
Because,
you don't know what else is on there?
well, I know there's a lot of other stuff on there. And when you get to the end, I may not agree.
Okay, can we prioritize things on our first run? Just check your priorities and then when we go back through.
No, I don't wanna prioritize now. I wanna just get a general sense of whether or not the committee.
Well, I think it's a
Support
good
that.
thing, but
Yeah, but when we get to the end and you're like, wait, there's way too much, you can put that as number 17 of your priorities.
Good.
Does that sound good?
yeah, it's not
Okay.
good.
Mike,
Do you want
what's that?
that number?
Yes.
Yeah.
Part B premium this year is $185 a month, the Part B deductible is $257.
What?
$257.
And you wouldn't happen to remember offhand approximately what the average person on Medicare spends for cost share or per year? I know that last year it was several $1,000s, right?
I don't remember.
Okay.
Did David tell you the number of QI one?
No. Oh, wait. It assumes that the QI is up to 202. Okay. Is everyone in general support of this? You don't have to make it a high priority. We're not prioritizing yet. Okay, let's move on. We see good stuff. Keep the numbers on. So this is this the unfunded bridge money? This is the
Um,
mental health integration that is currently paid through the ACO.
Well, the numbers aren't matching.
I think I'm gonna skip over everything around this because I think we need to speak to, WellCare and
I know, that.
figure out exactly how much money this is.
Okay, yeah, and I tried to put placeholders. This one would be the health integration and CHE continuation. And then the next row is for the all payer impact. And there are several numbers over in the notes where I caught a few of the bridge funds and the purpose of them, but there are a couple I didn't, so I asked her to that in writing.
I think in the one, those numbers, a lot of those numbers that you have in there are in the, governor's recommend one time. Well, the one, the 1.6, 2.1 and 3.78, that's what makes up the governor's one time recommend.
Yeah.
10.8.
We might be able to
So-
pull those down.
We can pull those down. Let's get real numbers. Let's move on.
Yeah, okay.
Okay. Bridges to Health. They, I believe this was, they need 675,000 going forward for this year. I think I heard that they need 900,000 a year, but they are funded currently through September, so they only need to be funded for a 9-month period. Which is why it's 675. And it is recommended that we add 900,000 to the base with 675 for this year. And I have been sitting in a seat for now, this is my 5th year, and I have to say that every single year, Bridges has to come in and ask for funding. And it would be nice if they were just in the base and didn't have to come groveling every year. So. Yeah.
Yeah, I support it. Can I clarify? So 675,000 to close out 2025?
Was that 26? They are funded currently through September of 25. So they wouldn't need July, August, September.
Okay.
They would only need from October through June
June
30th of 26.
So that's a 675.
That's 675.
And what's up with the 900?
900 is a total year.
Okay.
So going forward, 900 will be in the base.
Yes, okay.
Totally support.
Anyone not support this? Okay. Thank you. House Health Care supports.
This is OPR.
Oh, yes. This was, if you recall, Deputy Secretary of State, Lauren Hibbert was in here. They are streamlining their mental health provider licensing, which they think will ultimately save money anyways, putting everything under the, all mental health under a license. I thought it was really sort of shocking when she talked about the nurses are all under the same and the savings they get for that and the amount of time that it takes to license someone, and they are asking for one-time $170,000 to support an FTE to get this moving.
I see this as essential because we've already commissioned the report that they've done, so they have sort of the marching orders of what they need to do, and this would be to kind of implement those next steps. I support it.
Me too. Yeah.
Anyone not support it?
Are we gonna, okay, moving forward,
Yep.
are we thinking about how we're gonna do that moving forward?
She thought fees would cover it, that they only needed one-time funding.
Yeah.
And then it would be paid for from fees and a revision of their OPR payment system.
Yeah.
And we can let a purpose figure it out then.
They get fees for when they do the licensing. This is just to get that full-time position to design the program to be able to then get the fees. So that's why it's a one-time.
The Secretary of State's.
Yeah.
You should put that in there.
The direct quote is, we anticipate that this will be a one-time request to establish the position and in the future that the OPR budget will be built to sustain this position. We are asking for this position and funding because we have completed our mental health licensure study.
All right, so looks like House Healthcare supports that. Vermont Network has requested funding for the nurse examiner. And I'm really sorry, I don't remember who came in on that. It
Charlie
was-
Glissman.
Oh. Charlie didn't testify.
No.
Was it? I'm sorry, Lori, no.
I don't know, the letter, Vermont Family or Vermont Network.
We had in the organization from Northeast Kingdom the other day. She was talking about that. Go ahead, Lori.
I don't know if we have other requests based on contingency funding, but I would think this is something that appropriations may already be looking at in regards to. Like, I just kind of feel like if we're gonna put money in, not that this isn't amazing, like we need this, but if we're gonna put federal funding potential, because we should be doing it for everything.
Right.
How do we pick just one?
Right. It is an outlier.
I'm gonna recommend that we say that we don't have enough information to make a recommendation. So Cathedral Square had multiple requests. Yes, they did. Do you want to summarize their request?
I mean, that's why I put the things in the notes column, and I think the proposal descriptions are pretty good. The biggest one, I would start with the biggest one, $2 million for a sash expansion. So that's 10 new sash panels across the state. The next is up at the top, the Sash for All pilot. It's to continue the current pilot that they have in the Brattleboro area. That serves 300 adults and kids. Next one down is a dental clinic throughout the state, dental clinics. It's 40,000. But these are all general fund as far as I know. Nolan, I don't know if you can confirm that. Sash dollars.
I can't, I don't have the information.
I don't think that's correct, because I see one is performing annual Medicare wellness visits in the home. Is anybody not familiar with Sash?
Well, we had Sash in. I think we're familiar with the work that they do. I think these are all sort of expansions of things that they would like to do. Larry,
I think for just in general, SASH is, my view is one of the most successful programs when we're looking at access to healthcare, meeting quality outcomes, and really meeting people where they are, without a lot of overhead, without a lot of administrative overhead. I think they're one of the most effective healthcare programs we have in the state. So I fully support their requests.
Leslie,
I agree with Maury, but I'm curious about why DMH isn't supporting Sash.
well, they're currently funded through the ACO and Blueprint.
So is it uncertainty about?
Yeah, this is,
Yeah.
it's an expansion.
Yeah,
Right.
And so what DMH is saying, we don't want to expand, or we don't invest in
I don't
expansion.
think DMH.
Well, it comes under their department,
Well,
in the
that's-
agency department, according to this.
Yeah, that's because they're recommending it. Doesn't mean that DMH said they were for or against it. They just have their proposal.
No, Sash did that for sure, but as their overseers, DMH.
No, that's Leslie, that's just, I put that there.
Oh,
Nobody, DMH has nothing to do with it.
yeah, that confused me, yeah, clearly.
This is where it would fall in the budget.
If
That's
we
what
add,
it-
it
if we add
would
it.
fall in the DMH budget if we add it.
Yes.
I think we want to hear DMH, comment or not.
Well, they didn't put it
Has
in their
nothing to do
budget.
with
It's not in their budget, so we can fairly feel comfortable saying,
This is-
they're nixing this.
This, well, no, this
No.
is an individual request.
No, I mean DMH.
No, they're not nixing it. It's not in their budget. Sash came to us. Cathedral Square came and said, we would like money to do this.
Yeah, but don't you think they went to DMH first? As part of the budget bill?
We don't know.
We don't.
Well, that's my curiosity.
I don't think we have.
My
I know we don't have time.
my memory, I'm sorry, go ahead.
No, done.
My memory is, everything here is an expansion of what they're already doing.
Yeah, if you read the notes, at least two of them are pilots, the pilot in Brattleboro. The mental health clinicians pilot has been going at least since 2024. The expansion of Sash for All. I think these are all things that they would be extending.
It's my recommendation that we recommend that in general, we support SASH. This committee has traditionally always supported SASH. And I mean, I don't think anyone wants to say, of course not. I think is there anyone who wouldn't love to do any of these things?
But we do have to prioritize.
Well, we're not doing that right
I
now.
understand that,
We
but
just are seeing whether or not we actually support it. Is there anyone who generally support it? That's good. Lori, did
I'll
you?
just say I'm generally supportive. I would not, when it comes to it, I would not prioritize the SASH expansion to 10 new panels across the state in place of helping out primary care providers.
I think we should pick this up tomorrow. I'm sorry, I don't think I can look at another number. I think we're gonna pick this up tomorrow. We're gonna plow through the rest of it. If people can take a look at the things that are on here and overnight be thinking about maybe your top prioritizing you personally, your top 5
just in the healthcare recommended funding.
in the recommended funding. Okay? Yes.
And if anyone has any corrections, glaring errors, et cetera, please reach out to me. Yep.
So, did you ask another question?
Yeah, sorry.
And so the section underneath that is the reimbursement rate recommendations. Do you want us to prioritize that too?
I think that I'm thinking of them all as one.
Okay.
It'll be hard to prioritize this without the numbers in there, Leslie. If you think the way I do at least. Be helpful to have the amount.
Okay, so let's take this down and. Okay, we're gonna move to CON. This gentleman has joined us. Did anyone order these cute little books?
Oh, those are from Sarah's office.
Yeah. Okay, we're going back to CON. So I think I've made a proposal. And on Friday, there was concerns around restricting CON or removing it, making it an exemption for state granted or state funded. And there have been some concerns over that, and we, our legislative council developed some language around creating sort of an expedited process for those. And we've heard some concerns from the various organizations that would be administering this and that would be doing the work of this, that there are issues. And I have made the suggestion to legislative council that we just completely remove anything exemption around state granted or state funded projects, that we just remove it from the exceptions.
So it means they have to go to school.
It means that if they meet the income threshold, the dollar thresholds, then they would have to go through the process just like anyone else. So they no longer become exempted.
Rationale?
Rationale is that I think it's a process that probably a lot of people and interested parties have to work on the process to ensure that it is able to be administered in the correct way and done correctly. And so it seems, I mean, they're already subject to the process. The only thing we're doing is we're just removing the idea that they are any exception. We still have the other exceptions in there for emergency ground transport and around completely depreciated equipment that if you're replacing. So is everyone generally in favor of that? It's fine. Okay, I'd really like to move this along, and it's a good bill, and I just feel like that was one small piece that was sort of hanging it up that can be better addressed in another way. So if Jen wants to put up the this is very difficult language you worked on. I'm pretty sure it's this right.
So that's section 3 of the way, is that?
Oh, yes, please.
Your senator said,
Okay.
wait until you said, okay.
The exception that we had, that we talked about last week, about, say like Rutland, that's already in the process,
Oh,
was that?
that's,
For Kirby Legislative Council, and that's in the effective date, and I didn't change that, so that's still in there. We'll look at that. So I will put it up. Christian, when you get a second, give me permission to share. Thank you.
Which one will it be now?
It will be draft 3.1 that I think Christian is in the process of posting, so it may be another couple minutes. Refresh before it shows up. But basically at this point, it's a clean version because I took out all the highlighted stuff that we looked at as the new section 3 and then unhighlighted the changes that we kept in for the effective date. So now this is still a strike all amendment on page 96, an act relating to increasing the monetary thresholds for certificates of need. We have the increased monetary thresholds. We have the means language. So a new healthcare project means any of the following instead of includes. And those monetary thresholds that we looked at, some of which are 10 million, 5 million, 3 million, not changed those since you changed them. So that language is all in section 1. And then we have the 50 million for the conceptual development phase certificate of need. And the $10 million that can be spent in advance. Then we have section 2 is the exclusions. So we have the exclusion for fully depreciated medical equipment. And we have the emergency and non-emergency ground ambulance services and affiliated agencies, equipment and supplies. And then finally, we just have that effective date. And for new projects, so to apply, the changes will apply to new projects initiated on or after July 1st, 2025 for applications for a CON that are already in process on that date, for which one or more persons have been granted interested party status. The jurisdictional thresholds and exclusions in place when the application was filed would continue to apply until a final decision is made. For applications that are already in process on July 1st, for which no person has been granted interested party status, the applicant may withdraw in accordance with board rules. And that is it.
So does that mean, Jen, that if there's a state project that's already started? Not started, but
In the CON process?
Yeah.
If somebody has been granted interested party status, then they would stay under the current, not these proposed new, but current thresholds. If there's no interested party status that has been granted, then they could withdraw it and the new standards would apply or new thresholds would apply. So it would treat a state project the same as any other project.
Now, is there any other place that state government is listed or mentioned or given exclusion that we need to take it out altogether? Because now we're taking it out.
Now we are remaining silent on state projects, so they are no different from any other project.
That's right. So is it written any other place?
Around certificate of need?
Yeah.
Don't believe so. There was no mention of them as treated any differently under the existing law.
Okay.
It was only when we put the language in the bill the bill as introduced, and then we made some additional changes in here, and now we have just taken out
So now
the
the
reference.
whole thing is eliminated.
So now there's no exclusion for state projects
Okay.
that's any different from anyone
I
else.
just don't want to get caught down the line and say, well, here it was right here.
No, it's the
Okay.
same as it,
Was
before.
before.
It's the same as it is right now at this current moment.
That's right.
Before
I
any,
wanted to make sure.
before any amendments.
Any questions? Okay. Well, I would, and this is version 3.1, correct?
3.1.
I would entertain,
Oh, we're voting?
yeah, oh, wait.
Take a drink of water.
Our clerk,
Yeah, I can do it. I'll fill it in later.
okay,
You're gonna put it back up on the
I make a motion that, what's the bill number?
H96.
That we approve H96, most recent version.
3.1.
3.1.
Second. All right. Any other committee discussion? Okay. Brian, I'm sorry, Betty's coming in. Hold on one second, everyone. I'm sorry. I'm going to say, will the clerk call the roll?
Representative Chino. Representative Cordis, yes. Representative Pritchler.
Yes.
Representative DeMar.
Yes.
Representative Goldman.
Yes.
Representative Houghton.
Yes.
Representative Page.
Yes.
Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative McFawn.
Yes.
Representative Black.
Yes.
Motion passes on a vote of 10-0-1.
All right. Thank you, everybody.
It's me.
Yeah, I think Mari's gonna report this. So it'll be on notice tomorrow, so up for action probably Thursday. Oh, actually, I do believe it has to go and make a stop in Ways and Means. Even though the word fee, I don't believe is in the bill because it affects the fees that are being collected for the CON process.
Well, because there are fewer projects that will be,
Fewer projects, so the fees will be less.
but the costs will be.
Costs will be less if you're not doing them. But I've talked to Ways and Means and I think it's going to do a very quick little stop
Okay.
in there. So anyways, thank you, everyone, and I think we're done for the day.